Like, our origin story is need. There was 0 syringe service programs. There was 0 outreach or true low barrier access to medically assisted treatment. There was no free Narcan. There was no disposal. There was no education. There was no support. We're not a medical center. We're not a public health entity. We are a nonprofit now, but we're not your typical structured service group helping others. We're just people who use drugs and love people who use drugs and have been in this community a long time. We're also the only program in Butte County and for a while in the surrounding areas.
I think we serve a very unique role within the community where we're catching a lot of people that aren't interacting with any other services. We're catching people that aren't going to the hospital, that aren't going to talk to like the county services about substance use.
In terms of MAT services, typically that looks like folks coming in to us during service hours on a Tuesday or Friday, or calling, and usually people know what they want. They know they've done a little bit of research or they have some history with medications for opioid use disorder. We kind of know which providers are gonna be the quickest, for whichever type of medication they want to be on. And then from there, it's kind of what we call a warm handoff. So do you have transportation? Do you need transportation? Do you have someone to sit with you? Do you want someone to sit with you?
The ways in which we collaborate with other organizations to get people in MAT is really helping them make the phone calls, being able to get them in as soon as possible, driving them to their appointments, being that body double and that hype person to be able to walk through that door the first time. And so we build relationships with those organizations so we can have really effective transitions into those programs.
Being someone that was a volunteer and just was hanging around clinic, and now a person who's working here, an employed member, I feel like my conversations about substance use and their drug use and recovery with them is 10 times different than what happens in other facilities. I think there is that level of trust where they feel that they can have more deeper conversations about what would this medication mean for me.
Yeah, I started using drugs at the age of 18. When I decided to get into recovery, they helped me, they were able to get me into a sober living environment, which kind of set the ball rolling to my recovery now. I mean, it takes time, trust isn't just built overnight, But with practice, I believe that people can come and really get comfortable.
There's still a lot of barriers to access. Okay, you can access medically assisted treatment at a medical spot at the county, but what's that actually gonna look like? You're gonna have to charge a phone, make an appointment, follow up, wait 2 weeks. Okay, that's not gonna work. Let's try the emergency room. And it's a lot of shifting knowledge. And so having a place where we can talk together about what's actually happening, get feedback from our community, and help support folks as they navigate that pretty complex process, and tell anyone that it exists.
When I first started, going through treatment and not using, there's always this isolation that happens where, you can't talk to the people that you used with, and being able to come into this space, see the people that I used to use with, gave me a new context to interact with them. It's really given me the ability to maintain those friendships.
The thing that I believe is special about NVHRC is the fact that they show compassion and they care about people. They don't judge people by their past mistakes or their life choices. They actually are there for you no matter what.
With the current state of things, one thing I take solace in, we have been taking care of each other long before we were allowed to, and we will take care of each other long after. And those are skills this community has that are hard fought and won, but we're gonna be here either way.